Hey everybody, it's Grace, and I am going to do a little update about my anxiety medication. I said I was going to do that, and yeah, I don't think I have kept up enough. But the first medication, I think it was, I went to change to this place. I think it was in March. I hear my dogs. And anyway, um, before then, I was just taking a medication, PRN, for anxiety. Like when I went to a business meeting or something that might cause stress because of my adrenal disorder. I have to have something that is, could be, if I'm in a stressful situation or like bad weather, I would take, I only take a quarter of it. And I've been told that's not good. But yeah, they're not happy. But my dogs. But I started, when I changed this place, the woman said, she's not going to renew it. First, she told me she was, and then I don't know what happened the next time, but I didn't renew it. And she gave me this other one, and this other one, it was just bad. It was just bad for me. I started feeling, I think the second day and the fifth day on it, I really had symptoms I didn't like. And so I kind of, I still took it for a few days, I think, and then I tapered off. And after tapering off of it, I was still having symptoms I didn't like. And and including it was, she said that it was for mainly for depression, which I don't have, and anxiety. And I was under the impression they were for both. But I've been through that before many years ago, and they said that they don't want to put me on a medication that's for depression because I don't have depression. Anyway, one of the pills that they were going to put me on way back in the 90s is the medication that I finally got on this second time with this one now. And I started taking it. I picked up the prescription at the end of, I think it was April 28th. And I waited a few days before I started taking it. So at this point, I'm thinking it's been at least a month, around a month that I've been on it, and I've stayed on it. At first, I did have a little bit of symptoms, but those went away, and it could have been allergies. I mean, so many of these things could be a combination of so many things, are not even related. But I like to think about what's going on with my health. This is only for me. Don't take it as anything for you. It's just my experience. I have an adrenal disorder, and a lot of people don't have an adrenal disorder. So it's what, kind of combination works for me. And it like on this medication, the usual dosage is 3 pills a day. She knows my, some health professional knows my condition, and she said just take 2. I'm taking 1 because medications just hit me hard. I'll be right back. Okay, now the one that I'm on now, that I've been on since about a month, it's one that's been tested. It's been around for many years, and I had told her I do not like taking anything that is new on the market. I just don't. That's my personal opinion. This is all my personal opinion. Read the disclaimer below. I'm not here on YouTube. I'm not a healthcare professional, but my personal experience has been anything that's new, I'm going to have a bad reaction to, an adverse reaction. And that's gone back since the 90s. And I mean, on any kind of medication. But so I said, told her that, but she put me on one anyway. When I went back to her, she wasn't happy. Apparently, she likes giving that one medication, and I did not appreciate that, you know. But I wasn't rude or anything, and basically she put me on this one. And like I said, it's one that's been tested, and here it is, no big problem. I like ones to be tested on people for many years, so if there's any really bad, you hear all the time medications that, are new on the market, and next thing you know, they're causing serious problems. But anyway, now to get to what it's doing to me now, what I feel, now it can be a combination, like I said, and it can be nothing. It can be, something else or just whatever. But one of the things I noticed was, I think she told me that it takes up to 5 weeks to get in your system. And, but then I read somewhere on maybe the thing that they give with the medication 5 days, or I might have been mistaken, and 5 to 10 days, but it was probably 5 weeks because that seems like, what's more of the norm. And but right away, something happened in my one of my siblings had a very bad situation, and I was already taking. I think I had started the day before that day taking this medication, and it could be something like a placebo effect. I don't know, what you would call it, but I felt calmer instead of getting like because of my adrenal disorder. Usually, like something really big, I will have a lot of anxiety. Now, I have a history with anxiety, and my history goes back since childhood. And at 2 points in my life, when I was once when I was 28 and once when I was 33, I actually experienced. I know I've mentioned this before. Um, what people pronounce as agoraphobia, but I believe it's actually agoraphobia. There's another one that sounds very similar. It's very different things. So, but anyway, people tend to pronounce agoraphobia because that's how it's basically that's how it's spelled. But I experienced that. I mean, I'm talking. I couldn't leave my home. Those 2 times when I was 28 and when I was 33, and then after that, the doctors when I was 35, a doctor put me on metformin for insulin resistance, which is also due to my adrenal disorder. So is hypertension. I've been on medication for high blood pressure, basically. Well, it is since I was 24, I think. But anyway, it took a while for them to adjust to the medications, get it right, all that kind of stuff. But that once I started taking the metformin, things really changed. There's a lot I can say about metformin. I really think it saved my life. I really do. But one of the it did a lot of changes in me all around. Oh, you hear this? If this doesn't flow, it's their fault. The dogs. But one of the good things that I noticed, and I started noticing right away, and I was 35 then. Okay, I started noticing right away, and I was a career student. The thing was that I wasn't experiencing like panic attacks in classes. Whenever it would happen, whenever it would get quiet in a classroom, like we're taking an exam, uh, I would start to have a panic attack. My palms would sweat, my heartbeat would go, real fast, and I wanted to get out of there. And eventually, at my university, they knew it. I'd seen doctors and everything, and so they let me take my exams in a quiet room alone. Nobody was there. They had a two-way window or whatever. All these dogs were driving me nuts. But anyway, so that helped me to take exams. I finished them in record time all the time. I do not know if the door's open. They can go and come when they want to. Uh-oh, one's taking my mouse with him. But anyway, so that was one thing. It seemed like once I started taking that metformin, it really got in my system. I started noticing that my panic attacks had, gone away. I mean, pretty much didn't have them. But I realized that I was studying psychology at the time, sociology. But I realized that a lot of it was what I had left over, what I could feel, was learned behaviors. Because all those years of being having panic attacks in special classrooms or work or place, something like that, where there was a crowd of people, that I had to teach myself, how to behave, how to do things. And I'm going to get those dogs out of here. This is okay. My dogs were trying to get in the show here. I'm telling you, they're not happy with me because they yelled out to go sit down. But they were trying to just make all kinds of noise and, what do they call it? Roughhouse with one another, or whatever dogs you call what dogs do, right in front of me. And they were pulling down things off the desk. It was like, really, dudes? Now Grumbling Gus is sitting next to me. He's upset, and the other one's sitting right across from me, and he's not happy because I told him to sit down. So anyway, where was I? I was talking about the anxiety. Yeah, the anxiety, the panic attacks. Just oh boy, here he comes again. The panic attacks really. I could sit in a classroom, and it was like the difference of night and day. Once I started to realize, this medication for insulin resistance seemed to be helping with my anxiety. And once I realized my confidence, I was no longer the wallflower in classrooms or, I did a lot of temporary jobs back then. I was no longer having to keep myself quiet because I was afraid of, a panic attack. And then I started like to bloom. I mean, I was 35, years old, and started to bloom, blossom. I was right in the classroom. I was talking. I was, contributing, and I was no longer just sitting back, afraid. I still have a problem with one thing, and that's allergies. I can't sit around people with perfume. And one of the universities, I moved around a lot, so I attended a lot of colleges and universities. But one of the universities was a woman's university, and it was a lot of perfume that I had to deal with. And, it was a lot. So I usually did sit at the back of the class because if somebody had too much perfume on, boy, that was not good for me. And of course, they would look at me as, what's your problem? Instead of saying, you don't come to a classroom, just have poured perfume on your body. I mean, it was bad. Other people would see it, smell it too. So anyway, so that happened, but the older I got, um, I'm not sure what the problem was, but the older I got, the medication, the metformin and everything, um, I started having them again. Started slowly building up to where I would have a panic, something like panic attacks. If it was a bad situation, I had seen a counselor during that time, and she said, "You're normal." She said your reactions to stressful situations are very normal, but I was on that medication, and but anyway, as time went by, like I said, I went to changed this place, and I wasn't seeing anybody for it. I was not seeing anybody, professional, anybody for my anxiety, because it really had pretty much gone away. But then this place, oh, he's going to start playing again. Let me be right back. Okay. Now that basically kind of gets you up to speed, I went to this new she's actually a nurse. This new place though, and new for me, and you know, anyway, so that brings you up to speed on where it is now. But one of the things that I'm thinking about now, and it's just for me, is it seems like in some ways, just like that experience when I got put on metformin for insulin resistance, and all of a sudden I just blossomed. I'm feeling it again with this medication, and it's just the beginning of it. So I'm not going to state, I really notice it yet. But the anxiety, that was panic. The anxiety is more of the daily thing, it was rather mild in comparison to a panic attack, of course, but it was just there. It was always a level of anxiety, and it seems to be, mellowing out. I'll put it that way, mellowing out, and part of me is starting to develop again. I've always been treated younger than my age because I always looked younger than my age, and that whole looking glass self. But once I turned, like I said, 50, I'll be 53 on Sunday. Things started to change once I turned 50. I started looking my age, and people started treating me more, and that's something right there that can cause you anxiety when people treat you one way before, and all of a sudden they're treating you another way. Yeah, but I do feel like because of this medication, the anxiety also is, like I say, mellowing out. I can develop in that area, in another area too, that I wasn't able to develop before so much. And I'm seeing it, I'm more of my age. My reactions aren't, I have theories on this. My reactions aren't young, like, I have a theory about, I had to pick this up when I was very young, how to guard myself from, try to reduce having a panic attack or something. And those were so young when I was young, developing child, that I carried them on through my adulthood, and it didn't allow me to develop. Somehow I'm just beginning to start thinking about this. So this is all just about me, for me anyway. Nobody should take any advice, counseling, none of that stuff. But I like to think about these things and see, what happens. Is it something that I should really, see it that way? Now, another thing, though, it wasn't all bad that my adrenal gland caused me, just everything bad. One of the things, but there's a theory about why people develop adrenal disorders, and mine is not one that is in any books. It's just me that has this condition, the way mine is, but it mimics one. It mimics an adrenal disorder, but it's not it. But anyway, there's theories I read back in the 90s about that early childhood trauma can cause this kind of adrenal disorder, one that is similar to, it mimics kind of in a way, not everything, but close enough. And I remember studying it when I was, in 7th or 8th grade. And I said, that sounds like me in a way. So I wish I would have carried on that thought from that, from my, I wasn't even a teenager then, I don't think, but I was preteen. But anyway, that's my thoughts on this right now. And this is getting really long. And so I just wanted to update, and hopefully next time I'll remember that I've said most of this and I won't say it. Remember, I'll be 53 on Sunday. So I'll talk to y'all later.